Well, he had been lying in the snow for 12 hours. He had no pulse, no heartbeat. The temperature outside was 5 degrees below zero.
A 25-year-old male that was found laying in a snowbank. The core temperature would not register with a tympanic thermometer. All signs lead us to believe that he's been dead for a considerable amount of time.
Given his age and the fact that he has induced hypothermia, I don't feel comfortable technically to call him.
And despite having no pulse, Dr. Gerald Coleman refused to give up on Justin Smith, leading to the unthinkable. They brought him back alive, even though it seemed like he had frozen.
Oh, goodness. There's some pictures of him right there and getting his family. Smith's story of survival is just one example of how doctors are now using this to save patients suffering from everything from oxygen deprivation to gunshot wounds. Dr. Marc Siegel, a member of our medical aid team, joins us now. Doctor, this is part medical miracle and part, well, I think God telling this doctor to not give up on this man.
And part good science, Heather. And the good science part of it is if you're cold, you may be able to last longer because your tissues don't need as much oxygen. Your brain doesn't need as much oxygen. You don't shut down your metabolism as quickly. And we like to say in medical circles that if you warm a person up, that's the first thing you have to do to figure out if they're still alive. Somebody comes in cold off the street, and I had this in Bellevue Hospital for 10 years. I worked in the ER. In the winter like this, we would bring in people that were frozen off the street and literally thaw them. No pulse, no heartbeat. You thaw them, and they wake up.
Unbelievable. This actually happened to my sister. Years ago, she was driving on a road out in Kansas, ran off the road into a ditch, wound up sliding under the steering wheel, and it was below zero, or approaching zero. She was there for hours. Eventually, somebody at sunup saw the car, went over, looked at her, and they couldn't find a pulse. Same thing. Took her to a hospital. A couple hours later, she was fine.
And, of course, they probably did CPR on the scene, Steve. We're taught that if somebody's cold, you still do CPR, even if you can't feel a heartbeat. And you know what? We're now using this therapeutically. Where literally, someone has a cardiac arrest, their chances of surviving, if I cool them down initially, their chances of surviving are greater.
So let's talk a little bit about what happens to the body when you cool it down. First of all, the metabolism slows by about 5 to 7% for every close to 2 degrees Fahrenheit that the body goes down. At 95 degrees Fahrenheit, just 3.6 below normal, a person will begin to shiver uncontrollably. We all know what that's like. At 90, their lips turn blue and they're slurring their speech. At 82, they fall asleep. And by the time the temperature plunges into the 60s, their heart will stop beating altogether. 2
points there, Steve. The first thing is that 89 degrees. I want to warn everybody out there that if you get into the really cold weather and you start to feel like you're blacking out or you're not quite focused, you better get out of there, because we're telling a very happy story here, but there's plenty of sad stories where somebody doesn't wake up. If you're starting to feel foggy or you're falling asleep, you better get out of the cold. The second thing is if you go below the 60-degree mark, you know, I probably can't bring you back. So when the heart stops beating, I probably can't bring you back. So I don't want people to think, you know, wow, no problem, I'm going to fall asleep and someone will bring me back. I have a range I can do it in. Below 60, probably not.
Well, doctor, part of what they did here, they gave him some warm blood, some fresh blood, and they also never gave up on CPR. They did that for 2 hours. That takes a lot of work. So a lot of folks want to know who can actually benefit from this. Does it have other applications?
And by the way, what we also do is we warm up the intravenous. We can give them warm blood. We use warm blankets. We use something called ECMO, where nowadays we can take the blood outside the body and reoxygenate it and warm it and put it back in. So we use
new technology?
Amazing. Amazing.
Is it new, or is this something they've been doing for a long time?
This is something that they've been doing for about 5–10 years, but in the last 5 years we've been using it effectively for this. We can use it for gunshot wounds. We can use it for cardiac arrest. Sometimes we can use it for after surgery to cool people down, keep their brain going longer, and then they wake up in better shape. We have to watch it, though, because when you're cold, your blood doesn't clot as well. So I don't tend to use it if someone is losing a lot of blood.
Well, I hope doctors know about this all across the country.
They do,
a lot of people.
They're going to know a lot more for this morning.
And a wonderful story. Dr. Siegel, thank you so much.
Happy ending.
Yeah.
All right.
Very glad about your sister.
Me too. I'm pretty sure she's watching right now. And it's cold where she's at.
What's your name again?
I'm not going to tell you which of my many sisters.
Okay, oh, right, that's right. Big fire.
I know
okay,
which
big
one.
Family.
I know which one.
All right.